Hello everyone, welcome back. So today we will be discussing another recall questions from the May 26, 2022 PLAB 1 exams. So let's go. Another question is, an adult presents with rash on buttocks and thigh. She has pain on hip and shoulder and synovial thickening is present. What will be the initial investigation of choice? So this is based on recall. So the exact age and the sex may not be known sometimes. So I have written here adult. There may be an old age woman most likely with rash on buttocks and thigh. And another history is pain on hip and shoulder. What we have to take care is pain. She has pain and pain is present on hip and shoulder. This means proximal part of body. So she has pain on hip and shoulder. And another clue is here, synovial thickening. Synovial thickening is present. What will be the initial investigation? What will be the initial investigation of this choice? So the options are full blood count, blood glucose, urea and creatinine kinase, ESR. So to this answer this question, we have to know what is the diagnosis. The most probable diagnosis here is polymyalgia rheumatica. Why? Because in polymyalgia rheumatica, there is pain on the proximal region most likely, and synovial thickening is also present. So the initial investigation for polymyalgia rheumatica will be ESR. So the answer here will be erythrocyte sedimentation rate, ESR. So the diagnosis is polymyalgia rheumatica and the investigation will be ESR. Another probable differential will be polymyositis. Sometimes we may be confused with the polymyositis versus polymyalgia rheumatica. So we should know some important differentiating points between them. In polymyalgia rheumatica, creatinine kinase will be normal, whereas in polymyositis, CK will be increased. This is the main differentiating investigation between two. So if in question there is given CK is raised, then it is most likely polymyositis. And in polymyositis, there is weakness. There is weakness rather than pain. Like in the question, there is given pain. Pain will be present in polymyalgia rheumatica, whereas in the polymyositis, there will be most likely weakness in the proximal part of the body. So in polymyositis, there will be increased CK as well as weakness. Whereas in polymyalgia rheumatica, ESR is more than 30. So in the question also we answered the ESR. So it presents as aching and stiffness, like in the question, pain. And another important point that we have to note regarding polymyalgia rheumatica is 50% have temporal arteritis, association with the temporal arteritis. Now we can link the polymyalgia rheumatica with the temporal arteritis. We know that in temporal arteritis, the initial investigation is ESR, right? And the definitive investigation is temporal artery biopsy. This is very important topic, temporal arteritis in PLAB 1. I hope you know this initial investigation for temporal arteritis is ESR. Definitive investigation is temporal artery biopsy. What is the treatment? Yes, steroid, right? Prednisolone. You have to give steroids before doing the biopsy because it is a eye-threatening condition. Sometimes the patient may lose their vision, so it is an emergency. So even if we suspect that the patient has temporal arteritis, we have to give steroids before doing biopsy. And the initial investigation will be ESR. So initial investigation in polymyalgia rheumatica as well as temporal arteritis is ESR. I hope you are clear. And similar question was given in another question also, and the treatment was asked. There was history given, signs and symptoms suggestive of polymyalgia rheumatica, and the treatment was asked. I hope now you know the answer will be prednisolone, as like in trigeminal neuralgia. So these were two questions that were asked in PLAB 1, May 26, 2022. I hope you are clear. Thank you.